Thank you, Madam Chairperson. This is our wastage from the beginning. A total of 12,686 doses wasted. These are mostly from temperature excursions. Ibig sabihin yan, either na frozen yung hindi dapat ma-freeze na vaccine or yung frozen na vaccine, yung mga Pfizer at saka Moderna, have gone past their required temperature. Meron din po tayong mga incidents na nasunog, like the one in Cotabato, like the one in San Nicolas, Ilocos Norte. Nung nasunog yung building, nasunog din yung vaccine. And then we have a few cases na nahulog, tapos yung walang label. So if there's no label, they do not administer. And then in some of the, in a few cases, nagkaroon tayo ng particles. So it's really the technique. So this is 12,686 wastage out of the 50 million doses that have already been administered, Madam Chairperson.
So Manang ASEC Mirna,
0.00 something. So,
in terms of the percentage?
0.001% of the
0.01%
of the 87 million that have arrived.
Of the 87 million.
Madam Chair.
Yes po. Pero po kung multiply natin, ASEC Mirna, yung 12,686 times, gamitin na lang natin yung 544 pesos na average or estimate for next year, since ayaw pang sabihin ni SEC yung presyo ng bawat bakuna for this year, that would total 6.9 million pesos. Tama po ba? Yun po ba yung halaga nung nasayang?
Can we have the question repeated, Madam Chair? Sorry.
Yes, Madam Chair. 12,686 doses wasted due to various causes. Kung i-multiply natin by 544 pesos, na yun yung estimate for the vaccines for next year. Dahil ayaw pa ngang ibigay ni Sec Duque ngayon yung presyo ng mga vaccines this year, 544 pesos times the 12,686 doses wasted this year would amount to 6.9 million pesos. So tama po ba na yun yung halaga nung nasayang of the vaccines this year, 6.9 million pesos?
Yes, Madam Chairperson, based on the estimate, the average cost of the vaccine.
All right. Salamat, ASEC Mirna. So, Madam Chair, I guess I've used up my remaining minutes. I'll just reserve my other questions for the second round. Maraming salamat, Madam Chair.
Thank you, Senator Risa. And now we go to Senator Binay, and then later, if Senator Gatchalian is back, he will have the floor. If not, we can go into the second round. Senator Bato also. Senator Binay, you have the floor.
Thank you, Madam Chairperson. Secretary Duque, siguro local concern muna. 2 years ago, we created the law creating a new regional hospital for Region 12. Pwede ho bang malaman kung kailan ang turnover nito?
This is the Soxargen General Hospital.
Yes.
Inaantay lang po. The turnover should have happened last month pa eh. But nagkaroon ng problema dun sa use of RAC agreement. I will follow that up with the regional director, si Mr. Aris Tan. Yun na lang po ang kulang eh. Otherwise, everything will be in order. The turnover ceremony should have happened. In fact, since since September pa po eh. Pero nga, titinong ko lang yung sa use of RAC kung kanila na pong na pirmahan.
Okay. Siguro hopefully, Secretary, by that time nasa floor itong budget nyo, hopefully naka-turnover na itong Soxargen Hospital.
Meron na po tayong tao doon. Yung pinaka namamahala doon is already a DOH official. So, pagkatapos yung use of rack, then there will be a full turnover. And we will give you an update, Madam Chairman, Madam
Okay.
Chairperson.
Okay. Thank you, Secretary. Moving to the next topic. Secretary, for this year po, we allocated a line item for the Cancer Assistance Fund tsaka dun sa NICA. Can you give us the rationale kung bakit minerge nyo na naman ulit ito for next year's budget? When in fact, dun sa batas, naka-specify doon na dapat may line item budget for Cancer Assistance Fund.
Madam Chair, may I respectfully request that USEC Rosette Vergere responds to the question. Madam Chair.
And siguro, just to add, Madam Chairperson, I think Senator Pia, ikaw nga yung it was under your watch, kaya nagkaroon ulit ng line item itong Cancer Assistance Fund, right?
I know it's in their wish list, but let's let Yusek respond to that.
Yes, Madam Chair, and good evening po, and Senator Binay, and to all of the honorable senators. First, it was the advice of the Department of Budget and Management that we just put it in just one line item doon po sa cancer fund natin or the cancer line item. But of late po, the Council for the Cancer, the NICA, has appealed that we add another 900 plus million, 926 million, so that it can be spent on the diagnostics of our cancer patients. And this is part of our appeal, Madam Chair and Senator Binay.
Yusek Vergere, dun sa under the item of prevention and control of non-communicable disease, how much is the budget for that?
Yes, Madam Chair, I'm just getting it.
And I guess dito sa budget na to, hindi lang cancer yung pwedeng maging beneficiary. Halo-halo na.
Yes, Madam Chair. For the cancer fund po, for this prevention and control of non-communicable diseases, it has a total of 756 million for 2021. But for 2022, we were given 786 million. And a big chunk of this would be specific for the cancer fund po. And this will be spent for cancer medicines, the 786 million, Madam Chair.
Okay. Ang kaso lang, hindi siya naging line item. Ganun po ba, Yusek Vergere?
Yes, Madam Chair.
Okay. Thank you. And then, punta na ho tayo ulit sa COVID-19 response. So, ngayon ho, what is our positivity rate?
Madam Chair, Sec, could I answer that?
Okay.
Please do.
Go ahead.
Yes, Madam Chair, currently our positivity rate for the national would be about 17.5%. And for the National Capital Region, it's about 11%, Madam Chair.
Okay, so basically, pareho pa rin, way above the 5% positivity rate na benchmark ng World Health. Tama po ba?
Yes, Madam Chair, but it has been reduced or it has declined tremendously in the past weeks.
Yes. And with that type of positivity rate, what should be our daily target tests?
Madam Chair, based from our estimates, for us to be able to reach the 5% positivity rate, we need around 107,000 tests per day.
107,000 tests. Okay. And as of today, parang I think naka 30,000 plus ba kayo o 40,000?
Madam Chair, we're averaging about 58 to 60,000 tests per day.
Okay. So it's way off dun sa 107,000 na daily target na tests natin. Tama po ba?
Yes, Madam Chair, but the other local governments and also other laboratories are also utilizing other means of diagnostic methodologies for COVID-19, like rapid antigen test and the other cartridge-based test.
Okay, pero ano na rin, but if yung standard niya is PCR test, so talagang kulang ho tayo, Yusek Vergere. And in fact, yung budget nyo nga for next year is only for 4.38 million tests, right?
Yes, Madam Chair.
So if we follow, assuming na at some point for next year, ganito yung positivity rate natin, kumbaga mauubos ka agad yung budget nyo in a month's time.
Yes, Madam Chair, that's the reason why the Department of Health is appealing for additional budget for our testing kits.
Okay, and siguro, Yusek Vergere, kasi isa din reklamo sa babae yung access to free testing for COVID. Di ba ang protocol ngayon, kahit may nararamdaman ka na kung wala ka namang close contact sa isang nag-positive, you cannot avail of yung free testing. Hindi po ba? Hindi niya pwedeng i-charge sa PhilHealth. Kumbaga out of pocket yan, yung first tests for COVID.
Madam Chair, actually, based on our protocols, all close contacts or those with symptoms are supposed to get their test. And based on our protocols, the PhilHealth should be able to fund or provide reimbursements for this test. It's part of their tiered benefit package for the testing requirements for the local governments.
Pero di ba yung Vergere, kailangan may close contact ka muna. Kunwari, ako, kunwari, para may sore throat na ako, so feeling ko baka COVID positive na ako. I have to pay for my tests first, di ba? Hindi ko naman pwedeng na charge to PhilHealth yan eh. Kasi wala naman akong close contact.
Madam Chair, if you go through our process and with the local governments, and if you already have symptoms, you're supposed to enjoy that benefit of having a free test, which will be reimbursed through our PhilHealth packaging.
But yun na nga, ang problema yung on the ground, hindi ganun yung nangyayari. Kaya parang there's clamor for better access to free testing.
Yes, Madam Chair, because the Department of Health procures the testing kits and provides these free testing kits to all of our laboratories. At the outset, it was both public and private. Ngayon po, we have shifted to just providing for the government facilities, but still, it should be provided based on what I have said. If it's within protocols, PhilHealth has to reimburse that.
Okay, so Yusek Vergere, for a time, you were providing free testing kits sa private laboratories?
At the outset, Madam Chair, because during the first, I think 2 or 3 months into this pandemic, there was really no access. So we were procuring for the whole country, and we wanted to ramp up our testing and have access to all of our local governments. That's why at the outset, meron ho tayong pagbigay. But pag tinignan ho natin yung tiers of the benefit package of PhilHealth, it was accounted for there that if you are given a donated kit, you're just supposed to claim this much amount of for the benefit package.
And namo-monitor nyo yun na yung binigay, and considering na may IT problem itong PhilHealth, namo-monitor nyo pa na yung libreng binigay ng testing kits, hindi na charge yung nagpa-test.
Madam Chair, I'm sorry.
And ilan tong pinrocure nyo that you gave to private laboratories?
Madam Chair, if I may ask help from the head of our laboratory network, ASEC Nestor Santiago, please. He has the inventories of our procured testing kits.
Go ahead.
ASEC Nestor.
ASEC Nestor, are you there?
Ma'am, yes po. Good evening po. Ma'am, as to the question for the private laboratories, actually, ma'am, binibigyan lang natin sila noon nung first months lang. But with the memorandum of agreement that they will comply with the PhilHealth packages. So pagka partly donated, they can just claim the 2,077 for that. Pag for the government naman, they can just claim 901. But for if the laboratories, the private laboratories are procuring their own, they can claim sa PhilHealth na 3,409, I think. So if you are in the category, even if you go to the private laboratory, it should be free because they can claim that in the PhilHealth. As to the number of
Quantity
private
po.
laboratories po, as to the number of private laboratories, wala po akong information sa ngayon. But at this point, limited na lang po yung private laboratories that we are having a memorandum of agreement. So konti na lang po yung inibigyan natin ng or dinodonate natin ng test kits.
Okay.
Over to you.
May quantity ho ba kayo during the first few months? Kung ilang piraso ho yung testing kits na nabigay natin sa private laboratories?
Ma'am, we can give you the copy po of the number of test kits given to the private labs. You can submit.
And kaya nyo ho bang kumbaga, i-match na itong dinonate nyo, tapos ito yung nabayaran lang ng PhilHealth?
Ma'am, we do not have actually an idea on how to determine kung yun po yung ginagamit nila, yun din yung dinonate and yun yung kiniklaim nila sa PhilHealth.
Hindi. So, kung ganun ho, Sec Santiago, may probability na parang yung isang private laboratory, charge niya yung nagpa-test, tapos at the same time, nag-claim din siya ng full sa PhilHealth. Kasi hindi nyo nga monitor kung ano yung donate. Kasi di ba, I would assume labo-labo na yan, di ba? If you're saying right now na you don't have that data na itong dinonate nyo, ito lang yung binayad ng PhilHealth.
Yes, ma'am. But the price, kung price po yung namomonitor natin, pero yun po, ang wala kaming idea kung nagdo-double charging yung private laboratory.
So the possibility of double charging, pwede.
Pwede po, may possibility po.
Okay, Madam Chairperson, siguro isa ta doon sa baka kailangan ng control mechanism kung paano nangyari na parang wala pala tayong safety net doon sa the possibility of double charging sa testing.
Madam Chair, may I request that PhilHealth answers the control mechanism that they have put in place to prevent this possible double charging?
Of course, PhilHealth, is it Attorney Gilan, or you have somebody to respond to that?
Please, let's recognize Dr. Gigi Domingo to answer.
Thank you, Madam Chair. Madam Chair, as noted earlier, can you hear me, Madam Chair?
Volume please, mahina ang boses nyo. We can't really hear you.
Yes, Madam Chair. Can you hear me now? No?
Much better. It's kind of muffled.
Madam Chair, can you hear me?
Better. Yes.
Madam Chair?
Yes.
Yes, okay. Madam Chair, during our claims processing review, when the claims come into us, we have adjudicators and medical personnel to review the claims, because if the items are donated, then that is indicated in the claims documents given to us, then we pay the appropriate amount. If it's fully donated, then 901, and 3,409 if there's no donation, and the other amount is 2,077. So there's a check within our claims processing, if are donated or not.
And so far, ano yung meron na hubang nakita na nagdo-double charging?
Madam Chair, I cannot say for sure for that, but if there is double charging, we will see that in the documents submitted to us. And therefore, we will just be paying the appropriate amount.
Okay. Hindi ko
In other words, Senator Nancy, if there's a concern that the ones who did the testing would not admit that it would not be documented, or they won't admit that they received payment, then there's no basis for PhilHealth, no, to know that there's a double payment.
charging.
Yeah.
Kasi kunwari out of pocket nung tao, technically, libre pala yung ginamit niya, di ba? So parang, I mean, there's no way for us to know, right? Parang ganun lumalabas ngayon. Na during that period, pwedeng ginagamit ng isang private laboratory or donated testing kits, pero china-charge niya yung nagpapatest. And usually out of pocket nga, madalas out of pocket eh. I mean, that scenario is very much possible. Hindi po ba? Ako, Secretary Duque, paano kung ganun yun nga yung scenario na hindi naman ginamit yung PhilHealth, nagbayad yung tao out of his own money, pero yung pala donated yung testing kits?
Alam ko meron silang control mechanism dyan. I'm not sure if Dr. Gigi Domingo can refer to a technical person who has put the control measures.
Pero kasi Secretary Duque, yung PhilHealth will only come in pag magre-reimburse or ginamit nila yung PhilHealth nila. Pero kunyari ako, nagbayad ako ng cash, yung pala yung ginagamit sa akin, supposed to be, dapat hindi ako sino-charge ng ganong kalaki kasi donated naman pala yung testing kits.
Tama ho kayo, 3-tiered yung fees, no? 3,800, 2,000 at saka 900 eh. So kung kayo nagbayad, dapat ma-reimburse kayo pero usually may sistema na sila diyan eh na kung member naman ng PhilHealth, hindi pwedeng magbayad. Kailangan naka-charge na sa PhilHealth kaagad yun, antimano. Can we have the PhilHealth to just please answer this very operational question issue? Thank you.
Pero kasi Secretary Duque, hindi nga
Health-
ako ang experience nga ho ngayon, nag-out of pocket na lang eh.
Can we have the PhilHealth? Kasi para baka meron ho kayong listahan itong mga taong ito so we can have them checked and verified. Can you give us a list of all of these people, Madam Chairperson? Thank you.
Chair,
Yes, PhilHealth?
Madam Chair. Madam Chair, a part of the documents that's submitted to us is an annex. It's an Annex E. It is certification of classification of at-risk individuals. So these are, it certifies that no charge was made to the patient or other charges and discounts were made against other actual charges. And this Annex E is signed by both the laboratory and the patient. So that's a safeguard that what the documents, the item, information the documents given to us are true.
Okay. Siguro Secretary Duque, can you just submit to the committee kung, makukuha niyo ba ngayon kung ilan ba tong testing kits na pinamigay niyo to different laboratories? Just the total.
Yeah, yes, Madam Chairperson, the COVID lab network will give you a copy of the volume, the quantity of test kits. Okay,
and hindi nyo ho ba as part of the strategy kasi I I think, di ba, yung numero ho natin bumaba kasi ang naging strategy is nag-lockdown tayo, which hindi talaga siya sustainable. Hindi ho ba kasi nagiging yung testing natin kulang yung tracing natin, treatment kulang din. But moving forward, Secretary Duque, how do we address itong need for more testing, tracing, and treatment? I think more kayo dun sa testing and treatment eh. How will we prepare for another surge?
The strategy now has essentially changed. Hindi kagaya last year, we had no vaccines to even speak of. Now kasi na pagka narating natin yung population protection or the herd immunity, so to speak, no? Baka yung atin need for testing, the investment there or the budget required will have to be realigned already to other interventions, no? Like for those who are vulnerable, but even the vulnerable ngayon, sabi ng WHO, they should be given, yung mga elderly and those immunocompromised can be given the third shot or the booster dose. No? So kasi ngayon, malaking bahagi ng atin laban sa COVID ang bakuna. So magbabago talaga ang atin approach. Pangalawa, yung atin pong papunta na po tayo sa localized or granular lockdowns. Hindi na po tayo hanggat sa maaari, iwasan na po natin yung mga widespread community quarantines, yung MECQ, GCQ, yung ECQ, MECQ, GCQ, and MGCQ. No? So, pupunta na po tayo sa alert leveling system, mas localized ang lockdowns.
Yeah, pero Secretary, di ba, based na din dun sa experience ng other countries na halos fully vaccinated na yung population nila, nakaka-experience pa rin sila ng outbreaks. I think yung tinatawag nilang breakthrough na mukhang hindi lang talaga yung pagbabakuna yung solusyon dun sa how we will live with the virus. Which for me, I think importante pa rin yung testing and preparing for the treatment. And apparently, parang dun sa programa, kulang na kulang ho yung testing. And hindi ho ba naisip ng DOH to create more laboratories na government-owned na mas magiging accessible to our people?
Tama kayo, Madam Chairperson. Sa ngayon ay humabot na tayo sa mga 240 or 250 laboratories throughout. At marami na rin pong lumalabas ngayon na mga bagong testing modalities na hopefully this will be more affordable, more accessible, na hindi na masyadong mabigat sa gobyerno. So isa po yan na tinitingnan ng ating COVID lab expert panel. At sila po hinihingian ko ng kanilang recommendation. Paano ba ang impact ng testing in 2022 kung halimbawa tumaas na ang ating vaccine coverage? Although tama kayo, may breakthrough infection, ang mahalaga naman ay ang bakuna ay napatunayan na ito effective para sa pag-iwas sa severe and critical COVID infection, maiwasan ang hospitalization at maiwasan din ang pagpanaw mula sa COVID. So inaantay ko lang po yung recommendation ng ating laboratory expert panel and we will give you a report on what the recommendation will be in the next few days, Madam Chairperson.
Okay. And doon naman sa treatment, kasi lalong-lalo na sa probinsya na nakaka-experience ng high COVID cases, mukhang nagkakaroon ho ng shortage sa oxygen. How are we addressing this problem?
Yan po ay tinutugunan ng ating Department of Trade and Industry na patuloy ang pagkikipag-ugnayan sa ating pong mga liquid oxygen manufacturing companies. At isa po sa estratehiya dyan ay yung kanilang kaagaran pag-convert ng kanilang industrial grade oxygen to medical grade oxygen. So naumpisahan na po ito. at nakapagdadala na po sila ng mga liquid oxygen sa mga iba't ibang lugar or probinsya. So yung meron po tayo ngayon oxygen production capacity report versus latest demand data mula po sa aming tanggapan. Ang Luzon situation po ay meron na pong mga DOH hospitals in selected regions in Luzon. Meron pong paunti-unting shortage pero natutugunan naman po, no? In fact, kaninang umaga ba yun o kahapon nagkaroon ng nasira yung tulay sa La Union, hindi makapag-deliver, no? So they had to create a detour road, pero maigi naman, harinawa ay natugunan nito at na ipadala yung ating pong mga oxygen mula sa galing sa Cagayan Valley Medical Center, nagpahiram, at saka yung isa po galing naman po sa Pangasinan, sa Region 1 Medical Center, at saka sa Ingasco, yung pong supplier. So, ganun din naman po tinutugunan sa Visayas at Mindanao. So, si Secretary Mon Lopez at saka ako po ay tuloy-tuloy na binomonitor yung oxygen supply. At so far, minsan nagkakaproblema ho, pero natutugunan naman po. Salamat po.
Okay. And then, actually, the past week, so halos every day, may dumadating na bakuna, Secretary Duque. But pag pupunta ho kayo sa probinsya, ang kadalasang reklamo ho ng mga LGU, walang naglalanding sa kanila na vaccine. How are we addressing this problem?
Madam Chair, kindly recognize Yusek Mirna Kabutahe for a more definitive answer. Yusek Mirna.
Thank you, Madam Chair. We are now focusing outside of NCR, Region 3 and 4A, and we are giving vaccines to all regions with many arrivals late last month and early this month. Even Pfizer, we are giving to all the regions now, Madam Chairperson.
Actually, Yusek Mirna, meron ba kayong well, as the vaccines are coming in, meron ba kayong formula na ginagamit na, okay, kunyari si Binyan, X number yung makukuha nilang bakuna. May ganun ba kayong competition na sinusunod? Kasi di ba parang nagiging reklamo din na may favoritism, bakit yung ganito LGU, mas marami siya nakukuha compared to the other one. Meron ba kayong formula na sinusunod na kunyari yung population, X percentage, may ganun ho ba kayong formula?
Yes, ma'am, Madam Chair. Now that we have enough vaccines, we are looking at the unvaccinated. Ilan po yung unvaccinated sa area, and then we appropriate, allocate the number of vaccines. Pero tinitingnan din po natin yung kahandaan ng area, no? Ang dumadating ng mga vaccines sa atin ngayon ay Pfizer at saka Moderna. Dapat po may appropriate na cold chain facility, yung tinatawag na ULF. Pero pwede na rin siyang ilagay sa +2 to +8 in a certain number of days, no? So aside from the kahandaan, we are also factoring in, Madam Chair, yung saan yung mga surge areas, no? Kung saan marami ang cases, binubuhusan din natin ng additional vaccine. Ngayon, ang tinitingnan, now that we have enough vaccines, we're also looking at the capacity to jab these vaccines. Kasi while in some areas po walang bakuna, in other areas po, hindi gumagalaw yung kanilang mga bakuna. So, Secretary Duque and Secretary Galvez have been urging and directing our regional directors to be more on the ground, to be able to replenish yung mabilis na magbakuna, tapos yung hindi gumagana yung mga bakuna nila, to ask them to produce some more. And nagbibigay po tayo ng tinatawag natin ngayong CHD buffer. So ang allocation po 50% meron tayong focus area. So ito po, kung isang allocation ng region, 50% po goes to the areas na focus, yung mga key cities tapos densely populated. 30% goes to the province. Kunwari po sa Laguna, may identified tayong area na densely populated. 50% goes to them. And then the 30% goes to the province of Laguna para po i-distribute sa other areas that are not so fast moving and saka wala pong mga ganong mga problema ng surge. And then 20% goes to the region para makita niya ngayon kung sino yung mabilis na nagbabakuna, pwede niyang i-replenish kaagad, Madam Chair.
Pero Yusek Mir, na nakakagulat lang na parang hanggang ngayon hindi pa handa. Di ba bago natin tayo nag-order ng bakuna, yung on the ground, ready na. I mean, nag-order tayo ng Pfizer, yung pala, yung mga lugar hindi ready to accept Pfizer vaccines. So parang nakakagulat na hanggang ngayon, hindi pa rin handa. Hindi ba habang nag-aantay tayo dun sa vaccines, pinaghandaan na natin para pagdating ng bakuna, okay na. But bakit ngayon, problema pa rin yung paghahanda?
Madam Chairperson, yung LGUs, no, unless they already have the vaccine, yung tinatawag na naninibago, nanganganay, they need to establish some cadence. Hindi kagaya din dito sa NCR. When we started, they were ready, they had simulation, but it took some time for them to develop that cadence. So, yan po, and confidence na sa pag-handle ng vaccine, medyo natatakot yung iba. So, we needed to give them more confidence that pwede na nilang i-job yung mga areas. And of course, there are some problem of namimili po ng bakuna in some areas. Some prefer the mRNA, yung Pfizer and Moderna. Some prefer even the Sinovac also in some areas. So yun ngayon ang klase ng allocation ng vaccine that we need to do.
Okay, para sa facility, so, naghanda naman ho yung mga LGU. Like, kunwari, yung refrigeration nila, or hindi pa din?
Many of them already have the regular cold chain equipments, yung refrigerator, but some of them do not have the ultra-low freezer. Kaya ang ginagawa po natin ay parang may hubs and spokes tayo. So kung sa isang probinsya, meron siyang capacity po, dinadala natin yung Pfizer dyan. Pagkatapos, i-deliver niya sa RHU para yung tinatawag nating on-time delivery. So pag meron na siyang in-store doon na Pfizer, dadalhin niya sa isang munisipyo. Sa munisipyo, pwede po sa +2 to +8 na refrigerator. Pero kailangan, ma-job yun ng mga, for the first doses, kailangan po ng 5 to 7 days kasi pag nabuksan na yung vial na within 1 day na gamit na. But then, meron na ngayon na allowed ang Pfizer that you can store it in +2 to +8 na refrigerator. Kailangan lang po sigurong dagdagan ng ibang cold chain kasi we also have the regular vaccines. Nung kukunti pa po, kampante sila, but now that there are more vaccines, they should add in some areas additional cold chain equipments po.
Okay. Sige. Siguro, Madam Chairperson, for submission na lang, yung based dun sa dumating na ng mga bakuna, ilan na dun yung na-deploy sa iba't ibang probinsya?
Yes, Madam Chairperson, we will be able to provide the number by region, by province, and by type of vaccine.
Okay. Thank you, Madam Chairperson.
Thank you po.
Just to add to the discussion now raised by Senator Binay, I'm sure DOH knows, and we will all recall that maybe a month or 2 months ago, there were studies that came out that it's the mRNA, Pfizer, and the like that seem to be more effective, no? And that's why there was a campaign, of course, to say that Sinovac is still effective. But on that note, We leave it up to you and kindly submit na lang din if there is then in fact, because I remember Secretary Galvez did address that don't worry, we are getting more of the mRNA type. So on that note, I would suppose following Senator Binay's line of thinking that prepare din yung mga recipients nyo for that kind. Kasi we wouldn't know if we're talking 6 months ago and nobody really assumed that there was, of course, there was already preliminary studies that the effectivity of the mRNA were higher, but then Delta wasn't really a factor yet, right? So when Delta became a factor and there seems to be evidence to the effect that these are the types of vaccines that may be more effective. And Secretary Galvez did specifically say that don't worry, we are purchasing more. Then that also should have gone with the corresponding, we are preparing more. Because already in my mind, hala, paano yun kung yun ang dapat gamitin na drug? Because the storage facilities in the province, we already knew from way back, are not equipped, no? So that level of comfort on our part also that they are, kasi so far from what I'm hearing now, hindi. Kasi ang sagot nyo, Yusek Mirna, is they're ready with the regular cold storage, di ba? So nandun pa rin tayo sa paano ba talaga if we end up getting more. The chart I saw that cumulatively, mas marami na yung non-Sinovac. So Sinovac is the largest single purchase, but cumulatively, all the other drugs are slightly more than Sinovac. And if half of those would require different, the below zero, then you need to be prepared.
Madam Chairperson, siguro, just to add, I don't know if it's true. Kasi for example, yung Moderna, di ba, ang daming dumating. Kaso lang hindi ato siya na-deploy because of the handling that it needs. So I don't know kung totoo yun, na hindi talaga distribute
USEC to respond
outside of Metro Manila.
Yeah, let's ask USEC to respond, and then just to inform everyone that we can now do our second round. Senator Gilon is here, Senator Ping is here. You're the two I will call first. So Senator USEC Mirna, please respond, and then we'll proceed with our second round.
Yes, Madam Chairperson. In terms of the cold chain equipments, some of the LGUs have bought. We have also proposed for ADB and JICA and UNICEF, but these are not coming. So that is the reason Sec Charlie was requesting that instead of buying the vaccine, they buy the cold chain equipments. But we are looking to that into a hubs and spokes and giving them confidence that they can put it in a +2 to +8 refrigerator. For the comments on the efficacy of the vaccines, Yusek Rosette can give you the all experts group view on what vaccines the experts are proposing, because Sinovac is still effective, although the efficacy is lower. If you will allow Yusek Rosette, Your Honors, Madam Chair.
Yeah, very quickly. I mean, I think I unless my summary was inaccurate, no, all the vaccines are effective. I've always said that they're all effective. We are using them. They are allowed. However, there seems to be a higher effectivity rate with especially against Delta with the other types of vaccine other than Sinovac, and that's why there seemed to be a move to procure more. That's all I'm saying. Is that accurate or is that wrong? Feel free to amend my statement, Yusek Rosette.
Yes, Madam Chair. Not to amend, ma'am. Actually, the reasoning is right naman po. Kaya lang, ang sinasabi lang naman po ng mga experts natin that all of the vaccines right now, including Sinovac, has that high efficacy against deaths and hospitalizations. Now, in terms of preventing symptomatic infections, even from the start naman po, we know that Sinovac had lesser efficacy against symptomatic infections. But as what we always say, the goal really of our vaccination is for us to prevent the severity and deaths for our country.
Thank you for that clarification. That's actually what I say, but due to the late hour, hindi ko na clarify yun. Thank you for clarifying that. I do say that now. What we are targeting is that there are no severe cases and deaths, which all of the vaccines so far are able to do. Yes. Okay, so Senator Gilon, you have the floor. If you want to do a second round, if you want to just listen, we'll ask Senator Ping.
Can we have the second round on another day? I'm already tired.
Yeah.
I've been
Great.
sitting here for 6 hours.
And I know you want to listen as well. So if we all agree, I just was making myself available, but I will search. You do want a second round, no? So I will look for a date. No
Yeah.
problem.
If that's no problem, we would appreciate it, ma'am.
Sige,
We've been
so
here for 6 hours.
sure, no problem. Is that okay with everyone? I mean, because I know Senator Dillon wants to listen also. No? It's just not just a question of asking.
Yes.
So hold off on the questions. I will look for a date immediately. If I can find a date that doesn't conflict with other hearings this week, I'll call it this week because we have deadlines from our chairman on the submissions. And of course, I welcome all your amendments. No. So on that note, Secretary Duque, President Giren, we thank you so much for the time that you've given us this afternoon and this evening, to all the USECs and all the executive directors and your staffs and the agencies, the specialty hospitals. This hearing is just suspended. So do come back. I will, Mr. Minority Floor Leader, with your permission, can we waive the 3-day notice if there's no conflict? If there's no conflict with
There,
other.
since it's just suspended,
Yeah.
it's just suspended. You can set it anytime. Yes,
Okay.
I have no problems with it.
I will not set it at 8 a.m. tomorrow morning.
Madam Chair.
Yes, Secretary Duque.
Yun lang po nga kanina that I committed to look into the off-budget account, yung 448 billion. I have given this report now na it is supposed to be 448 million. Nagkamali po yung Eastern Visayas Medical Center sa kanya pong submission. Kasi dapat ang in-input niya in the thousands, no? So, this resulted into a bloated account. For 2021, the number should have only been 21.3 billion instead of 448 billion, and we will coordinate with DBM to have this corrected. But Your Honors, let me just reassure you that we are committed to review use of hospital income, and this commitment stands because ang laki po ng amount. Tama po kayo, the amounts are just too big to ignore. Thank you, Madam Chairperson.
Okay, thank you very much, everyone. It's still early enough to have a good dinner. Good health requires that you eat well and sleep well. And I'll end on not just a positive note or reminder, no, but I noticed dun sa budget ng PhilHealth, there was a 5 billion request for budget for dialysis, no? And I just want to point out, this goes with my ending of sleep well, eat well. When I was in apparently even in developed countries, there's not enough push, there's not enough information being given to people to how to avoid renal problems, no, on healthy living. There's not enough. We're not doing enough to tell people that this is what you have to do to avoid. And in a nutshell, it's exercise, eating lots of vegetables, getting enough sleep, and living healthy and avoiding tobacco and alcohol. So that is my non-medical advice for everyone. On that note, see you all as we find a common a date that is available, possibly tomorrow, but definitely not in the morning, but maybe Monday, maybe Friday. If not, I'll try to find another date next week. Thank you, everyone. Have a good evening.
Thank you, Madam Chair. Thank you, Your Honors. Thank you, DOH team. Thank you very much.
Thank you po.